Narcissistic personality disorder is one of the subtypes of cluster B personality disorders. It is considered to be one of the least identified personality disorders. Described sometimes as excessive selfishness, it has been recognized throughout history. In ancient Greece, the concept was understood as hubris. So, what's in the name? Roman poet Ovid, in his book Metamorphoses, Book 3, written in 8 AD, tells the mythical story of a handsome young man, Narcissus. In Greek mythology, Narcissus was a hunter from Thespe in Boeotia, or modern-day Karaburun, Izmir in Turkey. He was known for rejecting advances of many potential lovers. When Narcissus rejected Echo, a nymph, the gods punished Narcissus by making him fall in love with his own reflection in a pool of water. Narcissus did not realize it was merely his own reflection and fell deeply in love with it, as if it were somebody else. Unable to leave the allure of his image, he eventually realized that his love could not be reciprocated, and he melted away from the fire of passion burning inside of him, eventually turning into a gold and white flower. The Narcissus flower, or daffodil as we know it today, is what was left of Narcissus. It wasn't until the late 1800s that narcissism began to be defined in psychological terms. From Paul Knack and Otto Rank to Ernest Jones, Sigmund Freud, and Robert Walder, it has been described in different contexts as some type of sexual perversion to a symptom of psychosis to a normal developmental stage. Robert Walder, an Australian psychoanalyst, was the first to conceptualize narcissism as a personality trait. To diagnose this condition, let's see what the DSM, or Diagnostic and Statistical Manual of Mental Disorders, has to say. As per DSM-5, NPD, or Narcissistic Personality Disorder, starts by early adulthood and occurs in a range of situations, as signified by the existence of any 5 of the following 9 standards. 1. A grandiose logic of self-importance. 2. A fixation with fantasies of infinite success, control, brilliance, beauty, or idyllic love. 3. A credence that he or she is extraordinary and exceptional and can only be understood by or should connect with other extraordinary or important people or institutions. 4. A desire for unwarranted admiration. 5. A sense of entitlement. 6. Interpersonally oppressive behavior. 7. No form of empathy. 8. Resentment of others or a conviction that others are resentful of him or her. And 9. A display of egotistical and conceited behaviors or attitudes. Now, to make things more complicated, there are numerous subtypes and classification used, like the grandiose versus vulnerable type to the oblivious versus hypervigilant type versus the exhibitionist type. If that was not enough, Theodore Millon, an American psychologist, further suggested 5 subtypes of NPD. Whew! Now that can make anyone dizzy, even a narcissist. Let's simplify it. The 3 most important characteristics of NPD you need to understand are A. Grandiosity, B. Seeking excessive admiration, and C. Lack of empathy. In most cases, on the exterior at least, these people act with an air of right and control, dismissing others and frequently showcasing condescending attitudes. But internally, they battle with strong feelings of low self-esteem and inadequacy. They also may achieve great achievements, but ultimately, their functioning in society can be affected as these 3 characteristics interfere with both personal and professional relationships. Grandiosity and seeking excessive admiration are easy to understand. But what about empathy? Empathy is the ability to perceive and share another person's emotional state and has been described by philosophers and psychologists for centuries. The part of the brain responsible for empathy is in the cerebral cortex, specifically the anterior insular cortex. Studies have shown that empathy deficits in patients with brain damage to the anterior insular cortex are surprisingly similar to the empathy deficits found in several psychiatric conditions like narcissistic personality disorder, autism spectrum disorders, borderline personality disorder, schizophrenia, and conduct disorders. People suffering from narcissistic personality disorder just don't know how to give empathy. They insist on receiving it, but they will never give it unless it is to manipulate someone. In fact, their left anterior insular region has less gray mass or volume, which means they are hardwired to not be able to give genuine empathy. Narcissists can dish out criticism and judgment, but are completely unable to handle it if they receive it, and very importantly, they are unable to forgive and forget. Let's crunch some numbers now. Narcissistic personality disorder is one of the least identified personality disorders. Within the general population, the prevalence rate is less than 1%. That means about 0.5% of the United States population has it, yet within the clinical population, this number rises to about 2 to 16%. The condition is found in 6% of the forensic population, 20% of the military population, and 17% of first-year medical students. Narcissistic personality disorder is more prevalent in males, with about 18% of males presenting with NPD compared to 6% of females. Comorbidity is common with major depressive disorders. Comorbid is about 45 to 50% of NPD patients. Bipolar disorder presents in 5 to 11% of patients, whereas 24 to 64.2% of patients have comorbid substance abuse disorders. Many people wonder what causes someone to have narcissistic personality disorder, and are there any risk factors? Although the cause of narcissistic personality disorder isn't known, some researchers think that in biologically vulnerable children, parenting styles that are either overprotective or neglectful may have an impact. It is the mismatch in parent-child relationships with either excessive adoration or excessive criticism, not in harmony with the child's experience, that significantly increase the risk. Genetics and neurobiology, remember people with small anterior insular cortexes, also may play a role. How is NPD diagnosed? While no particular laboratory tests help with the diagnosis of NPD, a urine toxicology screen may be important to exclude substance abuse such as alcohol and drugs as likely reasons of the pathology. Your physician or therapist may use certain psychometric tests like the Narcissistic Personality Inventory or Milan Clinical Multi-Axel Inventory. By and large, the formal assessment involves evaluation of medical history, physical examination, and if necessary, imaging tests. And finally, is there any treatment? There are multiple types of psychotherapies that are employed, from psychoanalytic therapies using Kernberg and Kahoot method to cognitive behavioral therapies to group therapies. The specific choice of treatment is based on individual presentations. No actual medications are indicated for the treatment of NPD. People who suffer from NPD rarely seek mental health treatment. When they do, it is often to seek relief from a comorbid mental disorder, including major depressive disorder, a substance use disorder, or bipolar disorder. In such cases, medications may be indicated. Thanks for watching. See you next time.